So let me give a wrap up of day one, okay? So if you have any question, you can ask. Just stop me and ask. So we started just a quick recap of what we have already done. That was yesterday. So we started with emergency scene management. Remember that this is the foundation. We describe this as everything you do during first aid to lessen the impact of emergency. So that is actually the essence of emergency scene management. So emergency scene management. So emergency scene management. The aim is to manage emergency. So when there's emergency, which actually in most cases will leave negative impact. So every emergency has negative impact. Okay? The impact of emergency is always negative. And emergency happens to patient. Okay? And when that happens, the patient may become ill or injured. Okay? So the patient may be ill or injured. Patient is the person that has emergency, right? And patient could be an infant, remember, a child, and what? Adult. Yeah, those are the three categories of patient. So infant is under 1 year, a baby. Okay, a child is
1 year till puberty.
Yes, 1 year until puberty, and then adult is from puberty up. Okay, so when that happens, this person needs help. Okay, and the helper here is the first aid provider. So first aid provider is going to help. Okay, so everything you do to lessen the impact, that negative impact, belongs to emergency scene management. Okay, so the main objective of emergency scene management is to lessen the impact of emergency on the patient. And yesterday we saw that emergency scene management comprises of 4 sequences, right? So we have scene survey. So step 1 is scene survey, right? And this is when you survey the surrounding area where the emergency has happened. Okay, you need to. You don't have to take things for granted. The reason why this is important, the reason why you have to assess that area for danger is because there is no completely hazard-free area. There is none. There is no completely hazard-free environment. There is none. Okay? So that's the reason why you have to do the scene survey, and then we also looked at what? Primary survey. Primary survey. So primary survey, which is a big one. Primary survey. And the third one is what? Secondary survey. Secondary survey. Okay. So, and then the final one is what? Ongoing patient care.
Okay.
Ongoing patient care. So those are the 4 sequences of 4 steps that make up emergency scene management. What this means is that whenever you are doing first aid, you go through this sequence. Okay, you have to start from here. Okay, here your main focus is your personal safety. Your safety is important, your protection is important. Your protection is important. You also need to obtain consent here. Okay, of course, there are other questions you may ask at that point. Questions like how many people are involved, how many people are affected, what are the mechanisms of injury. So, and are there people around you can call upon? So that is what you cover at this point before you move to primary survey. And this is where you want to know if the patient is in any life-threatening condition. So you have to rapidly assess the patient, right? What are the 4 areas you assess here? R, A, B, C. R is what? Responsiveness. So you want to know if the patient is responsive. Airway. We want to know whether the airway is open. Because, and then breathing, is breathing normal? Is your patient breathing okay? And then what? Circulation. Very important area. Those 4 areas determine life. If anything happens to any of these or combination of these, that is considered life-threatening. And this is where you determine that by assessing those 4 areas. Okay? Is your patient responsive? So if you make noise, hey, are you okay? Can you hear me? Will your patient be able to respond in any way? So if your patient moves or talks, that means your patient is conscious, is responsive. But if your patient does not respond, does not react to that stimulus or stimuli, your sound is a stimulus. Your touch, if you tap your patient like, hey, are you okay? Can you hear me? That is stimulus too. So you are using both of them. Okay? So use, hey, are you okay? Can you hear me? Are you okay? Can you hear me? Gently. Tap the shoulders while you are asking, are you okay? So you are assessing responsiveness. Okay? And then airway. So you want to know if your patient airway is open, which is very important. Remember that airway is the tract, is the passage through which breathing happens. So is that passageway that connects the lungs to the outside world through the nostril. So that is very, very critical to determining somebody's life. So you want to know if it is patent, if it is open, because it is critical. Breathing too. Is my patient breathing? Not only breathing, but is breathing normal? That's the normal breathing. Normal breathing. And yesterday we described normal breathing. Okay? The rate. In 1 minute, how many times is that person breathing? For an adult, what's the number? 12 to 20. That's normal. Adult at rest. Okay, remember that normal breathing should be effortless. You should be noiseless. Okay, you shouldn't labor to breathe. It should be free, smooth. So those are things you assess here. So circulation, how well is the blood moving around the body? And here we talk about the heart, talk about blood vessels, talk about the blood itself. Those are the 3 key players when you talk about circulatory system. Okay, so we say if somebody's skin is not normal, looking normal, the temperature is not normal, is not warm to touch, or you see blood, those are circulation compromise. There's a problem there. Okay, and then you should be able to know what to do if any of them is affected or many of them are affected. It's considered life-threatening. You must call 911 and do something because the person's life is threatened. So primary survey is very, very important. It determines the direction. So that's why I like describing it as GPS, because it's the one that gives you the direction to go. Okay? And then, of course, this is also where you call 911 once there is life-threatening issues. There are life-threatening issues. If there are life-threatening issues, you must call 911 and then you do your first aid. So there are multiple things to do depending on the nature of the emergency, right? Okay, so secondary survey, this is where you assess the patient for non-life-threatening, right? Non-life-threatening. So here is non-life-threatening injuries. So this is where you assess patient. You want to know if there are other injuries that are not necessarily life-threatening. And yesterday we talked about the three main things you do here, right? Brief medical history of the patient, where you talk about sample. So we talked about vital signs. So you also have to get vital signs of the patient. And what is head-to-toe assessment? Okay, and then you can also get your patient ready to be transported to a hospital if you anticipate that the patient may go to a hospital. So this may be the time to get things ready for the patient. Okay, ongoing patient care. Okay, so this is the sequence. So at this point, if EMS has not come, if the paramedics have not arrived at this point, so you are expected to stay with your patient. Okay? Monitor your patient, keep on reassessing your patient, reassuring your patient, and if there's any manual support you need to do, continue doing the manual support. Okay, give me an example of one manual support. Do you know, give me an example. Does anybody know an example of manual support you may do?
If he's having head injury.
Okay, yes. What do you do?
We hold his head on one side, on supine position.
So what we call it SMR. Spinal motion restriction. So that is an example of manual support. So this is an example of manual support. Okay, you can actually do on the patient. Okay, so it's spinal motion restriction. So this is the type of support in which you prevent the neck and head, okay, from moving in any direction. Okay, so it's manual. So if you are doing it and you are at this stage, okay, keep on doing that. Don't let go. Okay. So remember that you should not give your patient anything to eat. Eat or drink, okay? Especially if it is medical condition. And of course, if it is low sugar and the person is conscious, you can give sugar. Those are some exceptions. Or maybe if somebody is in a cold weather and has gone into a hypothermic condition, okay, and the person is conscious, you can give something warm to drink, that's okay. But most of the medical conditions like heart attack, like stroke, like shock, okay, you are not supposed to give anything by mouth. Okay? So that is emergency scene management. And so we also looked at shock. So we also looked at shock. So medical shock, right? Yeah, remember there are two other types of shock we are not talking about here. So when we talk about shock, okay, we're talking about medical shock. Medical shock. Does anybody know what medical shock is? What did we say that yesterday? How did we define medical shock yesterday?
Inadequate delivery of blood.
Exactly, inadequate delivery. Okay, inadequate delivery of what?
Blood.
Okay, blood.
Oxygen.
Yeah, blood. So you have blood here. Okay, oxygen and what? Nutrients. Nutrients to
Vital
the
organ.
vital organs. Vital organs of the body. So give me an example of vital organs. Brain, heart,
Kidney.
kidneys,
Liver.
liver,
Lungs.
lungs. Those are the 5 key vital organs. So if the delivery of blood, oxygen, and nutrient goes down significantly, the body will go into medical shock. Okay? And remember the causes of shock. Okay? Causes of shock. Yesterday we looked at causes of shock. Heart attack, right? Heart attack.
Hydrogen.
Yeah, which is cardiogenic shock. Severe what?
Allergic reaction.
So severe allergic reaction, which is what?
Anaphylactic.
Anaphylactic shock. Severe bleeding or blood loss, which is what? Hypovolumic shock. Severe burns, which is what? Distributive shock. And then spinal or nerve injury, okay, which is what?
Neurogen.
Yeah, neurologic shock. Okay, and we also look at signs and symptoms of shock. Okay, signs and symptoms of shock. Do you still remember signs and symptoms?
Skin color.
Okay, signs and symptoms of shock. Signs and symptoms. So, yes, skin color is what? Skin is what?
Pale.
Skin pale, cool, and what? Clammy.
Clammy.
Yes, so clammy, and what about pulse?
Rapid and shallow.
Yes, rapid, weak pulse. Rapid, weak. Rapid, weak. So that's pulse. What about breathing? What about breathing? Rapid, shallow. Rapid what? Shallow breathing. So those are, and then the patient, other signs and symptoms maybe what? Nausea, vomiting, thirst, the person may be thirsty, anxiety, and level of consciousness. Depending on the stage. Okay, so the person may be alert. Okay, so the person may be alert at the initial time, but with the time, and the shock is going down or progressing, and as the shock is progressing, the level of consciousness may go down. The person may even get to the point of agitation. Okay, agitation may start, and then disoriented. Okay, at some point, the patient may be disoriented. Okay, so so because this is life-threatening, right? This is life-threatening because if you look at RABC, if you use RABC as to determine how serious it is. Skin color is pale, cool, and clammy. That is what? Circulation. Pulse is rapid, weak, which is circulation too. And then breathing. This is that. And of course, with this going down, RA is also affected at some point. So our conclusion is that the medical shock is what? Life-threatening. And because it's life-threatening, you're supposed to call 911 and then do your first aid. Remember, any emergency that requires 911, okay, you have to call 911 first. Make sure help is on the way, okay? Remember, you also need to hear for help so that people can come to help you. Yeah? Help anybody here. You can scream and shout so as to attract people's attention. And then you start your first aid. So remember that part of the first aid you do is to put the patient in supine position, and then take blanket and cover the patient to maintain the body temperature. Remember, at this point, the body is actually cooling. So part of your first aid is to cover your patient with a blanket. Don't give anything by mouth, anything to eat or drink. Stay with your patient on the EMS cams. Okay, so that is the medical shock. Okay, so another thing we look at is fainting. Fainting and unconsciousness. Fainting and unconsciousness. So, fainting and unconsciousness. So faint, when people faint, and also there's unconsciousness. Okay, so unconsciousness. Okay. There are two different conditions, even though they have common middle ground, they have common ground. They have an area where they share something in common. Fainting is loss of R. Loss of what?
Responsiveness.
Yeah, loss of R. R means responsiveness or consciousness. Loss of responsiveness for what? No more than what? A few minutes. A few minutes. So there's time association here. There's time. So loss of R. Loss of consciousness, R means responsiveness. So when somebody loses consciousness for no more than a few minutes. Why unconsciousness is also loss of R here, loss of R for more than. So more than a few minutes. Okay, a few minutes. Remember that. So that's it. So two of them, loss of R, loss of consciousness. But the difference is that this is shorter. And usually, this person should wake up within a few minutes. Otherwise, you are going to move it to what? Unconsciousness, which is more than an extended period of time. Okay? So over here, okay, so usually the person who faints is breathing. So breathing is intact. So breathing is okay. Breathing is okay. So that's fainting. R is gone, but breathing is there. Okay. So for that reason, what you do is that you're going to delay 911 because of the short time. So just observe. As long as this person is breathing good, the breathing is good. Okay? So you put the person in recovery position. Yesterday we demonstrated. So you put the person by the side. Okay? And that is safer, so that the airway will be open in case the person throws up. That is actually why you roll the person in recovery position. Okay? So, but if after a few minutes the person does not wake up, you cannot escalate it to this, and then you call 911. So this is where you now call 911 because you have exceeded this few minutes and the person is not waking up. So don't continue because you don't know what is going on. Don't delay further. Call 911 in case there is something else going on. So it is always better to be safe than sorry. Always. Okay, so don't delay for too long. So we also saw some of the things that can cause people to faint. Okay, some of them is what? If you stand one place, one position for too long, dehydration, lack of food can also cause it. Fear can cause it as well. Bad news can cause it. Traumatic information can cause it. Severe pain can cause it as well. People to faint. Okay. So signs and symptoms of fainting. Okay, signs and symptoms. Okay, the skin color may turn pale. The person may have the person usually will have dizziness, light-headed, nauseousness, like feeling like throwing up. Those are some of the signs and symptoms you have. Okay, so we also looked at bleeding and wound care. Bleeding and wound care. So bleed. So bleeding and wound care. So bleeding and wound care. Wound. So usually people bleed when there is wound. Okay. There are two types of bleeding: internal bleeding and external bleeding. So whenever the skin is affected, is torn, the skin is torn from that whatever is causing the wound, you see bleeding, and that is external. But sometimes bleeding can happen inside the body. You don't see it, but somebody is losing blood inside. Okay? Where you have that type of situation is when people have head injury, and then they could be bleeding from the ear, from the nose, from the mouth. Okay, and some, in fact, people, yeah, they bleed. That is a sign that somebody may be bleeding inside. Okay, all right. So, and we also define the two types of a wound: minor wound. So, wound could be minor or major. Okay, major wound. Minor wound is small, and minor wound you don't need to call 911. So minor wound, first aid is enough. Is enough here. So all you need is do your first aid, because is what first aid can handle. You don't need advanced care. But over here, major you need first aid as well. Plus you need 911. That EMS. You need to call EMS. Because first aid alone is not sufficient to handle major wound. And how do you determine that wound is major? How? Can anybody answer? What are you looking for before you can conclude that this is major? What are you seeing to make that conclusion? What are you looking at? What are you taking into consideration? Anybody? Two of them may have bleeding, right? Minor, this one is bleeding, but in a small amount. So when you say bleeding, what do you mean?
Like
large bleeding, bleeding. Okay, the person is bleeding profusely. Okay, and the bleeding is forceful. So we call it spout. Okay, it's coming forcefully. And usually this is from what? Artery. So when somebody is bleeding from artery, that is very dangerous. And it is major. Because it is, remember that most arteries carry blood away from the heart. So when the heart beats, blood rushes into the artery. So if there is any wound on that artery, that force will push the blood out. Okay? So we also talk about how deep it is, how deep the depth of the wound. We also talk about the source. What is causing it? The source. For example, gunshot or knife stabbing, those are, when you hear stuff like that, what comes to your mind is going to be a major wound. Okay? So this one bleed more. Of course, you expect more bleeding. You expect more bleeding. You lose more blood within a specific time. So if it is 5 minutes, let's assume 2 minutes. So if it is minor bleeding, minor wound, the bleeding will be less, much less compared to major. You bleed more if it is major. Okay? But so you need to, so first aid will come in. Okay? Major wound, you call 911. Here you don't call 911. So what do you need now to handle this type of situation? What do you need? You need first aid kit. Majorly, first aid kit. So every organization where you have employees, where you are working, should have this. And it is the responsibility of your management to provide it. Okay? And usually it is placed in a strategic location where people can easily identify and access. Okay? And when you open it, you have every supply you need. The gauze, which is dressing. So this is an example of dressing. So there are two things you need actually to provide wound care. To provide wound care, so you need dressing and bandage. Dressing, bandages, or bandage. Okay? So dressing, the example here is gauze. So gauze is a good example. Okay? Or you can use anything clean. If you don't have a gauze, you can use anything clean to do that. And here you have a lot of, bandage. So this is the one that goes directly on the wound. Okay, this is the one that, so dressing goes directly on the wound, while bandage will put pressure. Okay, so that's it. And there are different types of bandages you can find on the first aid kit. For example, the roller bandage. The roller bandage, you can see is a row. So roller bandage is in a row. And there's also the one we call triangular bandage. Triangular bandage, okay, you can also use. Remember triangular bandage? You also use it for splint and sling. Excuse me. Okay, yes, like this. So you have to resize it. Maybe you have to put it on a clean surface and then resize and use as bandage. So use it and so put the dressing and then put bandage on top. Direct pressure. Okay. But you also use indirect pressure if it is impaired object. If it is impaired object, so if the object is sticking in the skin, so this is somebody's skin and you have an object poking somebody, like broken glass, and that object is stuck there, okay? You don't use direct pressure here. This is called impaired object, impaired or embedded object, embedded. So you don't use direct pressure here. Instead, you use indirect pressure, indirect. So you put pressure by the side, not on top. Because if you put direct pressure, you'll be moving the object inside. And you shouldn't pull it out either. So don't pull the object out. So normally, the rule here is no pull, no push. So that is the rule here. No pull, no push. Okay? Remember, okay, that whenever you are dealing with blood, you must protect yourself. Okay? You must put your gloves. And after the care, you remove the gloves and wash your hand. Yesterday we practiced how to remove gloves. Basic but necessary. Because some people don't know how to do that. All right? So protect yourself because everybody is potentially infectious. That person you are helping may give you disease. You can even give the person disease. So by protecting yourself, by putting gloves, you are protecting yourself and you are protecting the patient. Okay? There are 4 routes through which disease can move around from one point to another point. Direct contact, indirect contact, airborne, and vector-borne. So by the time you do all those, you take all those protective measures, you are preventing disease from moving from one point to another point, and that is your responsibility. All right. So we also look at asthma and allergies. So let's see briefly asthma and allergies, what we talked about, what we already talked about. Asthma is what? Remember, what is asthma? Asthma is inflammatory airway condition. Inflammatory airway. So airway, you can see airway, RABC, that A is airway condition. So it's a condition, and it's a medical condition. Some people have condition, not all the people have this condition, but some people do. Some people have it. So inflammatory airway condition is what it is. So it means there's inflammation that is happening along the airway. Airway begins from the lungs and then ends at the nostrils. So it connects the lungs to the outside. Remember that oxygen has to come from outside and it has to enter the airway through the process of breathing. So breathing is what pulls oxygen from the atmosphere and it goes through the airway to the lungs. Okay? And so when some people are exposed to what you call triggers, there are something that can trigger this asthma in people, like chemical, vapor, or perfume. What else?
Pollens.
Yeah, pollens, stress.
Peanuts.
Yeah, yes, strenuous activity, cold weather in some people, okay, can trigger this. Even in some people, animals and all that. So we call them triggers. So when those people come around those stuff, they begin to experience it, okay? So when that happens, there's inflammation, and that inflammation is, there's what we call muscle spasm, okay? Muscle spasm that happens, so a kind of spasm that happens within the airway that generate mucus. So mucus produces a sticky substance. So this mucus will occupy the airway. So let's assume that this is airway, this is the nostril, this is airway to the lungs, right? To the lungs, like that. So the mucus will occupy part of this airway, depending on the amount. Some may have it in big amount, some may have it in small amount. So that's why you see that different people experience asthma at different level and degree. Some may be critical, some may be mild, some may be moderate. It depends on the amount of mucus produced. Okay? Remember, for you to have normal breathing, this airway must be free. So for you to have normal breathing, okay, breathing that is not characterized with laboring, you are struggling, that airway must be free of any blockage. So by this mucus is now constituting some constriction, some blockage. So the air that is coming here is no longer going to move smoothly. And the carbon dioxide that is going to be expelled is not going to be move smoothly either. So the problem the people that have asthma, the difficulty they have is as a result of this. The airway is no longer clear, okay, because of the mucus. And what are the signs and symptoms that we discussed yesterday? the increase in respiration rate. So breathing will go, the rate. Remember the rate in an adult is 12 to 20 times in 1 minute. So if an adult is experiencing asthma, the number will go 20 plus, it will go up. So the rate will go up. Remember that the person will now begin to use accessory muscles to help with the breathing, like neck muscles and intercostal muscles will be now used, because the diaphragm, which is the biggest muscle we use for breathing, is no longer doing it well, sufficiently. So it is going to need the help from the accessory muscles. And remember that also the person will go tripod. Okay, the person will go tripod position. So when somebody goes tripod position, it makes breathing easier, because tripod will expand the chest cavity. So you gain a little space that will make breathing better than when you are not in that position. Remember that the skin color changes as well, turning pale, and what else?
Restlessness.
Restlessness,
Anxiety.
coughing, wheezing, laboring to breathe, anxiety will come in, restlessness will be there as well. Okay? And then if you do RABC, using those signs and symptoms, you see that all of them, yesterday we discovered that all of them are affected. Coughing and wheezing here, right? Rate of respiration increases here. Skin color changing here, right? Restlessness here. Use of accessory muscles here. Tripod position here, because breathing. Yes, so you can see that all of them are affected. All those RABC that determine life-threatening conditions, they are all affected, and that's the reason why we say that this is a 911, and usually they have their inhaler. The inhaler, which is a bronchodilator. So inhaler will widen the airway so that normal breathing will resume. And people that have asthma, they carry their inhaler with them, and they know how to use it. All you need is assist them. Okay, remember as a first aider, we don't have authorization to give medication by default, unless you are working with any agency that are giving you the authorization. Otherwise, you cannot. Okay, so let's go to allergies. Allergies. So allergies, yesterday we described allergies as a kind of abnormal reaction, allergic reaction. Okay, so here the immune system is reacting to something that is harmless, something that doesn't really mean harm to the body. Okay, something that doesn't mean harm. The immune system is supposed to protect us by fighting off all those enemies like viruses, bacteria, fungi, parasites. Those are the invaders. Once they conquer part of the body, they cause problem. Those should be the target of the immune system. But some people have a kind of abnormal reaction. So when something enters their system, the immune system begins to attack those things, even though those things don't mean harm. So we saw a lot of examples like egg. Right? Some people are allergic to egg, peanut.
Grass.
Yeah, grass. Some people, they go through grass, and even some people flower, pollen. Yeah, pollen. Seafood. Yeah, seafood, shrimp, all those. Some people even some type of apple. Some people, nut. Some type of nut will trigger this. Okay? So, and then we saw that there are 3 levels that this can show in different people. Mild, right? Some people have it mild, some moderate, right? Some moderate, but there is also severe one. That severe one is called what? Anaphylaxis. So this is the deadly allergy reaction. This is the one that leads to anaphylactic shock. Anaphylactic shock, the deadly type of shock. Okay? And then we look at the terrible. This has horrible signs and symptoms, including diarrhea, abdominal pain, blockage of the airway, respiratory arrest can happen, cardiac arrest can happen, and that is the last one, the worst. Okay? So rashes, hives, the person's body may be turned red because of this. Okay, so and this place we describe the medication they usually carry. Okay, so they have their EpiPen. Yeah? And that EpiPen, they usually carry their EpiPen. And the EpiPen has the medication called what? What's the name? Epinephrine. Epinephrine. So that is this EpiPen has a blue and orange end. Okay, blue. One part is blue, one part is orange. So the blue is to sky. So remove it and then give it on this muzzle here. And hold it for about 5 seconds so that this medication will go in to reverse whatever is causing this reaction in the body. Okay? So it's also life-threatening. This one is life-threatening and must be treated urgently, very, very seriously too, because if you don't do anything, this person will die because the airway is blocked, the neck, the swelling that happens can block the airway. And once the airway blocks, remember that the only route through which oxygen can go through our body is the airway. So if it blocks, that's it. Okay? All right, we also look at head and spinal and pelvic injury. Let's talk about that briefly, and we move to the diabetes and seizures. We also looked at them. So head injury, let's quickly look at that. Head injury, yeah? Head injury, and there are 3 types of head injury: compressions, okay? Compressions, concussions, and what? Skull fractures. So skull fractures. Okay, so those are the 3 types of head injury. And there are 3 types of skull fractures. Compound fracture. Compound fracture is also called what? Open fracture. Because the bone is sticking out. So you see the bone from outside. So simple fracture. Simple fracture is called what? Closed fracture, because you don't see the bone, even though it has cracked. It has cracked, but you can't see the bone from outside. Then there is a depressed fracture, depressed. So depressed fracture. So this is when the bone is piercing the brain. So the bone is actually pointing toward the brain, maybe sticking on the brain. So it's called depressed fracture. So this one is caused by build-up of fluid. Build-up of fluid in the brain. Fluid. Okay? So the pressure from this build-up, the pressure is mounting on the brain, thereby compressing it. Even from the name, compression, that means there's a weight from that fluid. That weight is sitting on the brain, thereby compressing it. And the signs and symptoms include intense headache, okay, dilated pupils, drowsiness may be there, thinking problem, okay, change in behavior or personality, vomiting, the person may, or even nauseousness, feeling like throwing up, or even throwing up. So those are some of the signs and symptoms. Over here, this is when there's massive blow to the head. So if the blow is massive blow that can shake the brain inside, that can shake the brain, can lead to that. So if somebody you receive a very massive blow on the head, okay, and this can happen. Somebody can hit the head somewhere, or two players, people that are playing, okay, they can come together. Maybe they want to, like soccer, they want to head ball, and then two of them collide. Okay, another example is boxing. Yeah, boxing. So sometimes you hear about knockout. So when somebody is knocked out, that's actually concussion that is causing it most of the time. So the two prominent signs and symptoms, loss of balance and temporary loss of memory. That's the reason why the person is on the floor. And then they will be given some time to see whether the person can recover. That's why they tap out. They count 1, 2, 3, some 10, depending. Yeah. Then if you can't come back, if you can't wake up and show that you are ready to continue, you are out. Right? So it is from this. Some signs and symptoms from this, some signs and symptoms can happen immediately. Why some may happen
later?
Yeah, hours and days after. We call it delayed signs and symptoms. Okay? They may vomit right away. They may throw up. Okay? But loss of balance, loss of memory, always there. Okay? And sleeping pattern may change as well. In fact, most of the head injury may lead to change in sleeping pattern, okay, because of the effect on the brain. And so when somebody has concussion, the person should discontinue most activities. No driving, no biking, no climbing, no use. You can't work on heavy machinery because the brain is affected. In fact, it will require a doctor's authorization to go back to those activities. And so it's a very, very serious, use. So when somebody has head injury, remember we're talking about head injury, okay, head injury or head injuries. When somebody has experienced head injury, okay, you should call 911 right away, and you should not allow any movement, no movement on the neck and the head. You should prevent movement. The movement can make things worse. So you try yourself, your best, okay? And this is where you do SMR, okay, spinal motion restriction, to prevent the head shaking and moving. Okay? So calling 911 is important. Okay, so let's go to spinal injury. Spinal injury. So spinal injury is another type of injury that can happen. So spinal injury, okay, spinal injuries. So this can happen from fall, people falling. It can happen from car crash. It can happen from knife stabbing from the back, or somebody hitting somebody at the back. It can happen from anything, any biking or and all that, or even diving. People diving can also happen from diving. remember that the spine is very important because it connects the two main systems of the body. Okay, the two main systems of the body. You have central nervous system, which is your brain, and peripheral nervous system, which is outside the brain. Okay? Two of them must be able to relate for you to function as a human. So there is that link between the two, and that is the spine. Because the spine will send the message to the brain and then bring the message back to the sender. So with that spine, there will be a gulf, and that means communication is lost. Signal is lost, and the area affected will not be able to function. Okay? This is the situation when you hear about quadriplegic or paraplegic. That means the two legs are paralyzed, or the two hands and two legs are paralyzed. That was quadriplegic. So that means something has happened along the spinal area that controls the leg. So that area where the injury happens controls the leg. That's why the leg can't stand. The leg can't receive any signal anymore. Okay, something has happened, so it's not passing through. Even somebody may lose the ability to hold pee. So we call it incontinence. Somebody may be peeing on himself or herself. So because there's no signal going to the bladder to hold the pee. So these things can happen. So there are 5 regions of spine. There are 5 regions. So the first region is neck, which is a cervical region. So cervical. So this is neck region, neck. So following that is thoracic, and then lumbar. Lumbar is the next, going from the neck down. So you have a sacrum, okay, which is the fourth, and then the tailbone is called coccyx, the tailbone. So in that order, from neck, so from neck down. Okay. So the effect depends on where the region, whether it is going to affect the whole body from neck down or only the legs, depends on the region. So the worst place to have spinal injury is the neck. Because it means everything below the neck will be affected one way or the other. Okay? So signs and symptoms, okay? The person may not be able to feel anything. You may lose sensation on the legs, the hands. The person may have incontinence of urine and many more. So just like a head injury, 911, this is 911. And also try not to move the patient. Don't move. No movement. So as much as possible, don't move that patient. If there is no need. In fact, if there is no need to move the patient, don't move the patient. Okay? So, unless there's what we call log rolling. So log rolling is the only safest way to roll this patient on the side to avoid complication. Okay, but this will guarantee alignment. So alignment of head and body, neck, so alignment. So if alignment is maintained as you roll, that's okay. Where you have problem is where you don't have alignment. So log rolling is a technique, but you need at least 3 people to do this safely. 3 people. So one person at the head to to control the neck and head and 2 people by the side. So the person at the head is in charge. So at the count of 3, 1, 2, 3, they row at the same time. So that this alignment will be maintained. Because that is necessary, that is very, very important to avoid bending. Okay? So you use this log rolling, you use it when it is absolutely necessary. One example is if the patient throws up. You don't want to leave the patient in a supine position because they can choke. So at that time, you need to eliminate the vomit by putting the patient on the side using this technique. Okay. So pelvic injury is another one. So pelvic injury is also another part of it. Pelvic is lower. Okay, pelvic. So pelvic injury. So pelvic. Okay. So it's also part of lower spine. So when people have this, signs and symptoms, okay, the person may not be able to stand. Okay? The person will have pain in that area. There's possibility of blood showing in the urine. Blood. Okay? Because of the impact. The leg may splay apart. The leg. Splay. Yeah? The leg may go like this. Okay? And of course, the person may lose the ability to hold the pee. So there may be incontinence of urine. So, and other things. So again, just like every other injury along this line, so you must call 911. Is 911 as well, and no movement. Be careful with the movement. Okay, don't do any movement that is awkward. Okay? Don't do any movement that is awkward. So alignment is important. Making sure that the patient is in alignment from head to neck is very, very important to hear. Okay. So diabetes quickly. So remember what we said about diabetes. Can you remember what we said about diabetes yesterday?
Regulation of less insulin.
The what?
Regulation of less insulin.
Okay, inability, yes. So diabetes is when the ability to regulate the sugar is lost. So inability of the body to regulate sugar and insulin. That regulation is done by insulin. So if insulin is no more regulated, because it's natural, okay, whenever the sugar goes higher than acceptable limit, insulin is supposed to do the work, bring it lower to the acceptable limit. So if insulin is not doing that work, by and large, the person will be diagnosed with the diabetes. And we looked, yesterday we said there are type 1 and type 2, okay? And type 1 starts on time. This one has early onset. It starts on time. This may start later. So here there's zero production of insulin. So there's no zero production of insulin by the body. So the body has lost the ability to produce insulin. Yeah, there may be insulin, but the body is resisting it. So the person may have insulin, but the body does not allow it to work unless they do sometimes they do some exercise, activity, and they also have to be careful with what they eat. Okay? So, so remember the 2 emergencies we talked about yesterday: hypoglycemia and what? Hyper. So those are the 2 emergencies. Anybody living with diabetes should always watch these 2, because it can happen if you don't manage it very well. So this is low sugar, This happens when you have insulin. You have insulin without the sugar. There is no sugar, but there is insulin, no sugar or low sugar. So it's low sugar, little or no sugar. So then you have insulin in the system, but you have little or no sugar. Little or no sugar. Okay. So here you have sugar, but no insulin. So this is, you have sugar, blood sugar, with no insulin. With no insulin in the system, or little insulin in the system. So that's why you call this low sugar level, high sugar level. Okay, two of them are dangerous, but this is more dangerous because of the sudden, it has a quick onset, okay, and it can progress quick. Yes, it can progress quick. Why this may be delayed for hours or days before you begin to, before it becomes so serious. This one doesn't waste the time. And we saw some of the signs and symptoms yesterday. Yeah. For instance, here the skin is pale, cool and clammy. Here is dry, warm and flushed. Remember that over here there is no odor in the breath. Here you can perceive odor, like nail polish remover. Over here, level of consciousness, the person may be irritable. When the sugar is low, the person may be irritable, agitated, aggressive, confused. Yeah. While over here, the person looks intoxicated and may even get to the point of stupor. Okay? So first aid here, give sugar if the person is conscious. Give the person sugar. Okay? But if the person is unconscious, call 911. Over here, they take insulin because that's what they need. And since the body does not produce insulin, they have to take it externally. And of course, they carry it with them. Okay? So let's look at seizures. Seizure is neurological condition. Seizures, neurological condition. So meaning it starts from the brain. So it's neurological, meaning brain. So the origin of seizure is brain. Okay? And it happens when the unison in the brain is affected one way or the other. Unison. Because you have thousands of cells in the brain and they need unity. So if anything happens to the brain that reduces that or interferes with the unity, it will not lead to some activity in the brain that will generate electrical impulses. So that electrical impulses is actually what is responsible for the seizure activity. That electrical impulses. So, and yesterday we saw things that can lead to seizures, like low sugar. Hypoxia, no oxygen. What else?
Stroke.
Yes, stroke. What else? Head injury. What else? Alcohol withdrawal, drug overdose or drug withdrawal. Excessive neurological stimulation. Imbalance of electrolytes in the body. So these things are capable of interfering with the unity in the brain. And when that interference happens, it can lead to seizure because of the electrical impulses that will be generated. How many types of seizures did we talk about yesterday? 3 of them. 3 types. 3 types of seizures. Who can mention them? 1. Tonic, clonic. And what do we say about tonic-clonic is the most serious and most common type of seizure you can see in the community. Number 2 is what? Absence seizure. Absence seizure. And number 3 is what? Yes, febrile seizure, which is common in babies and children. And can result from what? High fever. So high fever in children can trigger this. So, but you can prevent it. Yesterday we talked about fever emergency, right? 38 degrees Celsius or more, greater or equal to 38 degrees Celsius or more in babies is considered fever emergency. But if it is greater or equal to 40 degrees Celsius or more in children, that is also emergency. Yeah, fever emergency. Meaning that if you are not careful, if you don't manage it, if you don't push it back to normal, it can actually lead to febrile seizure. So, and you can prevent this by giving Tylenol, Advil, according to doctor's prescription. You can cool the body down using what? Lukewarm water. And there are 3 areas you focus more. Where are those 3 areas? Behind the neck, armpit, and groin. And then it is also important to seek medical attention because of fever, right? So absence seizure happens from the brain as a result of the electrical impulses. But if the electrical impulses that are coming from the brain are coming in less chaotic manner, it will lead to this. But if the electrical impulse from the brain is coming in a chaotic manner, that will lead to the first one, chaotic manner. The electrical impulse is coming. Electrical impulses. So the way it comes from the brain determines whether it will go this or this. So if it is coming chaotically, in a very chaotic manner, it will lead to tonic-clonic. But if it is coming in a less chaotic manner, a little bit gentle manner, it will lead to absence seizure. And absence seizure is not, it doesn't show like tonic-clonic. Tonic-clonic is the one that many people actually recognize as seizure because of the shakiness, the muscle twitching, the rolling of the eyes, the foaming from the mouth, and the person will be unconscious, the skin color will change, the breathing will be very gruntling. So breathing, gruntling and all that, okay? But absent seizure, the person will just drift off and begin to gaze into the space and will never respond to anything within that time, okay? And we also told yesterday, we said that tonic-clonic seizure goes through 4 phases. The aura phase, right? That is phase 1. This is when they notice that seizure is coming. They get the message, usually because of the brain activity. Sometimes they see light, dot of light, or even they smell something. No, that person is smelling. Everything from the brain activity. Yeah? But it can end there, or it can progress to tonic phase. Remember that tonic phase is when the muscles of the body become stiff, rigid, so stiff. And then it moves to chronic phase. And this is when the muscles begin to relax. Yes, that's where you see the movement. Okay, is at this, and then this may last for maybe 1 minute, 30 seconds, 5 minutes, 4 minutes, and then at the end, the person will begin to wake up. And this is what you call post-theta phase. So this person is wake up. This is wake up time. The person begins to wake up. wake up. And when the person wakes up, the person looks tired, confused, and disoriented. And it may last for about maybe 10 minutes, 15 minutes. So the person looks so tired, so confused, so disoriented at that time. So it takes some time before the person reintegrates. Okay? So remember that first aid, okay, we said there are two things you should not do. Don't insert anything into the mouth, right? We said it yesterday, Abby?
Yes.
Right?
Yes.
Yes, we said it yesterday. Don't insert anything into the mouth. People do this into the mouth. Don't. Some area they are, because of fear of a biting tongue, they're taking spoon or knife and then they are forcing it. But in most cases, the jaws are clenched already. So they may end up causing injury to the patient. So it's not necessary. So we also said don't restrain the patient. Don't restrain. So don't stop the patient from shaking. Don't restrain the patient from shaking, from all those activities. Don't restrain. Okay, because it's not intentional. So there is no point to restraining. Instead of doing this, which are not necessary, you should prioritize what? Protection. Protect the person. That's where all your attention should go to. Protect by removing every dangerous object, anything that is capable of causing harm to this person. Remove it, push it away. Okay? And then protect the head especially. So protect the head by putting pillow, anything soft on the head to protect the head from injury. Observe your patient, monitor the breathing. Monitor, because breathing is usually very difficult to hear. So monitor, make sure that the breathing is not interfered. Okay? If the person is foaming and the foaming is too much, put the person in recovery position. Okay? One side. So that the foam, the fluid will drain off. Okay? And then when call 911 depending on your protocol, okay? Your company may have protocol, they may say, if this happens, call 911. So follow the company's protocol, okay? Otherwise, call 911, okay? If your patient is pregnant, if the seizure, either single episode or multiple episode is lasting up to 10 or more than 10 minutes, right? If your patient has never experienced seizure in the past or has no history of seizure or the cause of seizure is unknown, okay? Or maybe injury happens while the person is having seizure or the person is having seizure in water. So those are the patient asks you to call 911. So those conditions will warrant you calling 911, okay? All right, so finally let's talk about respiratory and cardiovascular, okay? Briefly, that will be the last one, okay, to wrap up day one, okay. So respiratory and cardiovascular emergencies. Respiratory. So when we talk about respiratory, what are we talking about?
Asthma?
No.
Oh, like airway.
We're talking about lungs.
Lungs.
We're talking about the key players: lungs, What else? Airway, yeah? I heard you say airway. And what? Diaphragm. These are the three members of the respiratory system. They help in gas exchange. They help us to bring oxygen and remove carbon dioxide. And the biggest muscle that does that job is this. But the one that is blowing, okay, is the lungs. And then the connector between the lungs and outside the world is airway. Three of them are very important. Okay? So, what emergencies are respiratory in nature? What emergencies can affect all this? What emergency can affect respiratory system? Give me an example. Asthma. So because asthma, remember, it is inflammatory airway condition. What else? Give me another emergency that can affect respiratory system.
Blunt chest trauma.
Yeah, blunt chest trauma. Yes.
Difficult to breathe.
Blunt chest trauma. And allergies, allergic reaction, because of the blockage of airway. So can also stop somebody from breathing. What about choking? Reaction. When people choking. Okay? Yeah, those are respiratory. They can affect our ability to breathe. That's it. That's one respiratory emergency. There are those emergencies that can affect one's ability to breathe normally. And that is usually serious. We have already seen this. We have seen this. Blunt chest trauma. We're going to look at flare chest. Okay, flare chest is an example. Flare chest. Okay. And we have seen this. Choking is when the airway is blocked by a foreign object. And it could be partial blockage or severe. Total, complete blockage, which is more severe. Okay, so cardiovascular system. So let's look at cardiovascular. So cardiovascular system. So what are the members? What are the members? The heart. So the main is the heart. What else? Blood vessels. Blood vessels. So you have two categories: arteries and veins. Arteries and veins. Okay, remember that most arteries carry oxygenated blood away from the heart, while most veins bring deoxygenated blood back to the heart. Okay. So the third one is what? Blood itself, which is the fluid that carries, that transport. So it's the transporter, whether it is oxygen, whether it is nutrient, everything we need is distributed through the blood. Everything. Okay, so those are the three members of cardiovascular system. Now tell me emergency that can affect cardiovascular system. What are the emergencies? Heart attack.
Heart attack.
So heart attack. What else? Angina. Remember? Angina and heart attack are similar. Okay? They affect the heart. Heart attack is as a result of blockage. Some certain artery is blocked, thereby preventing blood to reaching a part of the heart. Not the whole heart, but some part. the area where that artery is supplying blood to will be affected. Why angina is as a result of narrowing of artery, as a result of hardening. If the artery becomes hardened at some point, or maybe there's deposition of oil or fat on the area, and then it is piling up and making it narrow, it gets to a point where blood is managing to pass that area. And so the heart will still feel like nothing is going on, that the person is not receiving enough oxygen. What are the signs and symptoms? Because two of them have the same signs and symptoms. Does anybody remember? Signs and symptoms of heart attack or angina. Chest pain.
Chest pain.
That radiates to the mouth. What else? Dizziness.
Dizziness.
Yeah, dizziness. The skin color turning pale.
Turning pale.
The person is feeling nauseous, like throwing up. Shortness of breath is there. Denial is there. Denial. So denial means the person is not agreeing. The person doesn't want to believe that it's a heart attack. The person is dismissive. Okay? Of course, anxiety will set in. Anxiety. Because heart is a very vital organ. And now the heart is not performing optimally. So anxiety, the person is afraid. So remember, the person is also sweaty.
Yeah.
Sweaty. Clammy. Not just, this is not a normal sweat. Okay? So those are things you see there. And usually the 911, okay, 911, both of them, because on the surface you wouldn't know, okay, you wouldn't know whether it is this or this. This one is milder, this one comes and goes, the angina. Some angina can lead to heart attack, some, not always, not all the time, but it calls for follow-up. If somebody is having that type of experience, it's coming and going, especially if somebody is doing some hard work, you see the chest pain and all these things, and then let it to disappear. And sometimes it comes on again. You need to check it out. Okay? Yes. Before it goes to heart attack proper. So 911, and then the 911 may ask you if you have what? Aspirin to give, aspirin. Or nitroglycerin. Nitroglycerin. Okay, that's another one, but this one be careful. Because this one doesn't work well with the Viagra. Okay, like Viagra family of medication. They don't go well together. Okay, because two of them, Viagra and this, they do the same. They widen the blood vessels. So if somebody takes this and also have taken Viagra, is double widening. And that will lead to hypotension, which is very dangerous. So it's always good to ask the person before you give nitro, whether the person has taken Viagra or the family of Viagra. Okay? Yeah, so that is important. Another cardiovascular emergency is what? Ischemic attack. So that's another family. Ischemic attack. Okay? Which is actually popularly called what? Stroke. Popularly called stroke. There's another one that is equivalent to angina. It's called transient ischemic attack. Ischemic attack. Okay. So TIA. TIA. So two of them are similar. So remember, heart attack and angina affect the heart. Why ischemic attack and transient ischemic attack affect the brain? But the mechanism is the same, similar. Heart attack is total blockage of some artery, but to the heart. Ischemic attack is also as a result of blockage of some
Blockage.
artery to the brain.
Brain.
Angina is narrowing of some artery to the heart, part of the heart. Okay? While transient ischemic attack is also as a result of a narrowing of some artery to the brain.
Brain.
So the same mechanism. So what are the signs and symptoms of stroke? Remember, stroke can be as a result of blockage, or bleeding.
Bleeding.
Yeah, which you call hemorrhagic. So bleeding or blood clot. Yeah, bleeding in the brain. And also, we call it a hemorrhagic stroke. In fact, 20% is hemorrhagic in nature, while 80% is as a result of blockage. So what are the signs and symptoms of stroke?
Face drooping.
Yeah, just write F.
Yes.
So signs and symptoms of stroke. Stroke, whether it is TIA or the main stroke. Okay, so FAS. So this is what? First what? Drooping. So the mouth is bending one side, the face is drawing to one side. Arm weakness. So arm weakness and speech difficulty. Okay. So your first aid is to add what? T. Trying to do what? To call 911. So that's why when you hear fast, it's referring to stroke. Fast. So you need to act fast. Okay? All right. So now another cardiovascular emergency, another one is what?
Cardiac arrest.
Okay, before we go to cardiac arrest, blood pressure, high blood pressure. So high blood pressure is another one. High blood pressure. High blood pressure. Okay. So you know that blood pressure is measured by S and D. Yeah? Systolic and diastolic. Systolic is the pressure that the blood goes with when the heart pumps. Okay? Usually artery. So this is pressure in artery. Pressure in artery or arteries when the heart pumps. While diastolic is pressure that the blood is returning to heart with. So that is veins. So pressure in the vein. While systolic, okay, systolic pressure and diastolic pressure. Okay, so diastolic, also systolic. So usually systolic pressure is higher because of that push. Okay. So if blood pressure, and there's normal blood pressure, normal. So normal blood pressure is like 120,
By 80.
yeah, 80. So let's make it range, maybe depending on age, somebody's age, maybe 125 or 150 something to 85, stuff like that. So if anybody is here, but the best is 120. Yeah. It may be higher depending on somebody's age. Okay. So it's normal. So if somebody's blood pressure is here, within these ranges, that is normal. So if it is higher, then we talk about high blood pressure. That means the blood is now using more pressure to push than normal. Okay, and that is dangerous because it can lead to many things. It can lead to stroke, it can even kill somebody. It can lead to aneurysm, can actually burst blood vessel in the brain because of the too much pressure. And it's a silent killer, because it doesn't have obvious signs and symptoms. So people may be walking on the road and they don't know, they may not know that they have high blood pressure until it will strike one day. So it's always good to check. Go to Shopper Drug Mart. They have free machine you can use. People can buy the machine to check. So because of the nature, it's always good to check. Okay? So that is so cardiac arrest, which is where we're going to stop. Cardiac arrest is what? What is cardiac arrest? Anybody? So cardiac arrest is another cardiovascular emergency. Cardiac arrest. So this is when the heart stops pumping suddenly. When the heart stops pumping blood suddenly stops so that is cardiac arrest. The whole heart will just stop. Just like that. The heart will just snap. Will stop. Okay, so cardiac arrest, when the heart stops pumping blood suddenly, all of a sudden.
Is it due to like imbalance in electrical impulses?
Many things can lead to this. One of the main reasons why people have cardiac arrest is what you call when the heart is pumping so fast, when the pulse, like if you check the pulse, and the normal pulse is supposed to be 60 to 100. 60 to 100 per minute. This is how many times per 60 minutes per minute. This is normal heart rate. So, but if the heart is going so crazy, and is going, so that can crash the whole heart. Or maybe it's going too slow. Okay, the heart is sleepy. The other one is so fast. That can crash the heart. Or maybe it is what we call fibrillation. So it's shaking. So it's shaking instead of pumping. So the heart's supposed to be pumping like this, pushing blood and like that. This is systolic, and then it will relax. That is diastolic, and then it does again. But when it is now going like this, so it won't push, and that is cardiac. So there are many things that can lead to this. Many things can, like people that take a hard drug, so it's too much for the heart to take. It will just crash the whole heart. Yeah. So the heart is a serious condition. So when this happens, signs and symptoms of cardiac arrest, I'm going to put RABC here. Signs and symptoms. So signs and symptoms of cardiac arrest. You know RABC, responsiveness. So when cardiac arrest happens, responsiveness will be lost. So, the person will not be able to be aware of anything happening around. Okay, breathing is also gone.
Lost.
Circulation is also
lost.
gone. So the person will be unconscious, not breathing, and if you do pulse, you won't get any pulse. So it's 0, 0, 0, 0. Unconscious, no breathing, and what? No pulse. So this is 911, obviously. 911, immediately. Immediately you realize that this has happened and you check, hey, are you okay, can you hear me? No movement, you check breathing. You check the person's breathing and there's no breathing, it's not moving, okay? And of course the skin color, you will also see that skin color will show that circulation is not there. Okay, so you have to call 911 right away. And what else you do? You start what? CPR. Cardiopulmonary resuscitation. Cardiopulmonary resuscitation. So this is an attempt to manually pump blood for the person and manually breathe for the person. So when you do CPR on somebody, you are doing chest compressions. So you are, which is a manual process. Okay? Chest compressions followed by breath. You also breathe for the person using pocket mask. So this is pocket mask. So you do that. Okay? You breathe through pocket mask for your own protection. Okay? You keep on doing that. Usually you do 30 chest compression followed by 2 breath, which is 1 cycle. This is 1 cycle. And then you repeat it as many times as possible. So you repeat. So 30 chest compressions followed by 2 breath, repeat as many times as possible. So rate of compression, means in 1 minute, how many compressions are you expected to give in 1 minute? 100 to what? 120 per minute. So if in 1 minute you are not doing chest compression up to 100 to 120 in 1 minute, you are too slow. And if you are doing more than 1 minute, or if you are doing more than 120 in 1 minute, you are too fast. So if you do this math, 32 times n should be 4 to get this number. So that means in 1 minute you should be doing 4. You should be on your 4th cycle. 4th cycle. 4th what? Cycle in 1 minute for you to get that rate. Okay? You can prove it. Because 4 times 30 is what? 120. So that's where, so you should be somewhere on your 4th cycle. Okay. So keep on doing CPR, 32, keep on doing that. Don't stop. Until, when do you stop? EMS takes over, arrives and takes over, yeah?
When the patient is...
Patient begins to breathe. You stop. What else? You become tired. The first aider becomes exhausted. What else?
Bystander takes over.
Yeah, bystander. People who are passing by, but who decide to come and help. Then they take over. One more. Your safety. If your safety is no longer granted, you have to stop. Otherwise, you have to keep on going. 32. Don't stop. Because you need to, the person's heart is no longer pumping. So you need to start pumping that blood manually. Because the organs, the cells of the body, they need oxygen. So you need to manually circulate that, otherwise they will die. And once they die, that's it. So that's what they are doing in the meantime on the EMS comes. Another thing you can do is to use what we call AED, which is a machine, AED. Okay? This machine can give shock to the heart to reset the heart, to normalize the heartbeat. So AED means automated external defibrillator. Automated, because it's automated, it's a machine. Very easy to use. Okay? So you turn it on, it will talk to you. Okay? So you will have practiced that already. Then we're going to do more. Automated external defibrillator. So you call 911, start CPR, and if this machine arrives, you use it. You use it with the CPR, so you can combine two of them. You can combine CPR and AED. Okay? So if your patient is a baby, so you use 2 fingers to do your chest compression. 2 fingers for a baby. Okay? You look at the center of the chest, that's where you put the 2 fingers. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30, and then you give 2 breaths. And then you repeat. Okay? This is a baby. If this is a child is maybe 1 year, 2 years, 3 year old, up to puberty, until puberty. You use 1 hand depending on the size of the child. 1 hand. Okay? 1 hand up to 30. Okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then you give 2 breaths. Yeah? If this is adult, then you need two hands. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 24, 25, 26, 27, 28, 29, 30. 2 breaths. Watch the chest. And you repeat another 30. You continue until any of those conditions happens. Okay? And if AED comes, you use it. Okay? So if somebody brings AED, like this,
apply pads to patient's bare chest. Plug in pads connector next to flashing light. Apply pads, plug in connector. Apply pad, analyzing heart rhythm. Do not touch the patient.
everyone clear?
No shock advised. If needed, begin CPR.
Begin CPR for 2 minutes. So sometimes this will tell you shock. So I don't know why it's okay. Let me use the other machine. Let's see a case where shock is required. So let's use this. So let's start afresh. So turn it on. Step 1, turn it on. Put your pads.
Apply pads
Okay.
to patient's bare
Look at
chest.
the arrows. It
Plug in
will tell
pad
you where to
connector
put them.
next to flashing light.
And then you plug. Like this.
Do not touch Catch the patient.
Everyone clear?
Shock advised. Charging. Stay clear of patient.
I'm clear, you clear, everybody clear.
Deliver shock now. Press the orange button now.
Press the shock button to deliver shock.
Shock delivered.
Then you start CPR
Begin CPR.
for 2 minutes. So you keep on doing 32 for 2 minutes until this machine will tell you to stop. Okay. So that's how. So if you are 2 people doing this, every 2 minutes another person will take over because this is very tiring. Okay. All right. Do you have any question? Any question? Otherwise, we'll end it here now. Any question? So we are good with the wrap up of day 1. Okay. All right. Okay. So thank you so much. Thank you. Okay. So I think. Yeah, are you good?